There are many gynecological disorders that a woman would want to come and see us for, but the most common gynecological disorder would be the menstrual disorder. And menstrual disorder would vary from having painful periods to having abnormal uterine bleeding. This can happen from any time from puberty, from the start of or the onset of menses, to menopause. A common symptom that many women face is dysmenorrhea. Dysmenorrhea simply means painful menses. Painful menses generally takes place 4 to 5 years after the onset of menarche. Menarche is when it's the first menstrual cycle. The reason being that after these few years, a woman would generally start to have regular ovulation. With regular ovulation and the release of certain hormones like prostaglandins will result in painful periods. Dysmenorrhea or painful periods again generally improves with age and of course may tend to disappear once a woman reaches reproductive age group and especially after her first child. Treatment for such conditions is usually very symptomatic. They respond very well to simple analgesics, which can be taken at the time of their periods or when they feel the pain starting, and to stop as soon as the pain disappears within a couple of days. Sometimes, of course, dysmenorrhea can be very difficult. A woman may be incapacitated from her work with very difficult dysmenorrhea. In such instances, we may need stronger analgesics, or even we may institute a certain hormone replacement therapy, like the oral contraceptives. The oral contraceptives help by stopping ovulation and thus reducing the release of hormones that tend to cause the pain during menstruation. Sometimes the pain during menstruation may not be physiological, and this is what is called secondary dysmenorrhea. There are some causes to this, like from infections, fibroids, ovarian cysts, endometriosis. This may result in painful periods that are not necessarily treated by routine analgesics. All the patients with painful periods, 20% may actually have secondary dysmenorrhea. With secondary dysmenorrhea, it's important to have a detailed history of the menstrual cycle, painful intercourse, discharge will give us an idea to the causes of the secondary dysmenorrhea. Investigations that need to be performed would include an ultrasound, and to some instances, a diagnostic laparoscope would be important to have a clear view of the uterus and its appendages, and to see if there are disorders like endometriosis in the pelvic cavity. This can be treated at the time of the laparoscope by simple cautery or laser destruction, or it may be necessary for us to continue medical therapy. Uterine fibroids and cysts can also be removed at the time of laparoscope. Laparoscopic cystectomy, laparoscopic myomectomy are simple procedures. Tissue sampling can be done at the same time, and this can give us histological evidence, a diagnosis to the condition.